Thank you for joining, and we're going to go through these slides. And again, hopefully today's session brings you a little bit of clarity on the weird and wacky world of Medicare, which I know can be very confusing, but I'm here to help you understand the process. So my name again is Rafael Stella. I am a licensed and certified health plan advisor. I've been doing this since about 2012, and I work in LA County and surrounding areas. I represent Medicare Advantage plans, Medicare Supplements, and prescription drug plans. My goal is always to make sure that not only you understand the ins and outs of Medicare, but that also I answer your questions, because every single situation when it comes to Medicare is completely different. I always have this thing that I tell my clients. I say, Medicare is not a cookie cutter option. Just because your neighbor does certain things doesn't mean the same things apply to you. So it's very important to get as much information as possible. I do have 2 local offices. This just mentions my Torrance office. I also have an office in Hawthorne. Been around for a while. I'm not going anywhere. So definitely want to make sure that you understand that I will be around from here on out. And I've been working with different medical groups in the area for quite a while, 2012, like I mentioned. This is what we're going to cover today. We're going to cover enrollment periods, the basics of Medicare, your options once you have Medicare, and then we're going to have a Q&A session at the end. So if you do have questions, go ahead and jot them down, and then we'll cover them at the end just for the sake of time. And sometimes your questions do get answered as we go through the presentation. So at the end of the presentation, I would definitely give you a chance to ask me any questions that you may have. So options with Medicare. There's 3 basic options that are mentioned in this chart here. If you see on top, we have Medicare Advantage, we have Medicare Supplement, and then original Medicare. Now this chart, I show it in the very beginning of the presentation, because you're gonna see this at the end, and it's gonna make a lot more sense, okay? So as you can see, I have 3 options there on the right-hand side, and then the columns say yes, yes, no, 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 and then the services on the side. So all 3 options will definitely help you pay for hospital stays, help you with things like doctors, specialists, anything outside the hospital setting, preventative services. And as we get into the prescription drug coverage, you start seeing that some options do not have coverage. This doesn't mean that you will not be eligible for coverage for prescriptions. It just means that you will have to get it in addition to. If you can see, Medicare Advantage is the only one that all down the line has yeses on everything. And you'll understand why in a few minutes. Okay, the Medicare Supplement goes down the line. It also has, some yeses down there, but the top 3 are always, the most important. And of course, original Medicare, which covers your doctors, your specialists, and your hospitals when it comes down to what's called original Medicare. So again, this chart's gonna make a lot more sense at the end of the presentation. First, let's talk about enrollment periods. This is where most people come to me in the very beginning. They say, hey, Rafael, guess what? I'm about to turn 65. I'm getting all this mail. When do I enroll? The very first enrollment period is known as the IEP, or the initial enrollment period. This is when a person is turning 65. Okay, and then you have a 7-month period, which consists of 3 months before your birthday month, the month of, and 3 months after. This is known as your initial election period. You want to make sure that if you are going to go ahead and sign up for Medicare, that you do it during this time. And the reason why is because Medicare has very strict rules about the time of enrollment. Now, if you choose to bypass the time, and there's certain little things that make sense, and I'm going to mention that in a couple of slides, is you want to make sure that if you are going to go into Medicare, that you do it during the 7-month period, because if you don't get Part B when you're first eligible, your monthly premium will go up 10% for each 12-month period. You could have had Part B, but didn't. Believe it or not, I see a lot of folks out there that say, hey, well, you know what? I never get sick. I don't go to the doctor. I didn't want to get into Medicare. My neighbors told me I didn't need it. My coworkers told me I didn't need it. And again, this is not a cookie cutter option. I always want to make sure that there's at least a phone call made to Social Security, where that's the department that you're going to call to sign up for Medicare and find out if you need to go on Medicare. Now, before I go on, and we'll see this in a couple of slides, is there is an exception to the rule of getting Medicare. If you're working and you have insurance through work, you do not need to get Medicare at 65, okay? So a lot of folks say, well, I'm working, I'm 67, I've had insurance through my group plan for a while, I don't want to change it, and that's fine. However, understanding the fact that if you ever do need Medicare, when you go to Social Security to try to enroll into Medicare, let's say at 68, because now you're going to stop working and you no longer have insurance through work, Medicare has a specific form that states that you need to show proof that you had insurance elsewhere, and that's the reason you didn't get into Medicare. As a Medicare advisor, I always advise that even if you're working at 65, you go ahead and you call Social Security and get that process going just to get into the system. However, you do not have to enroll for Part B, you only have to enroll for Part A. So we'll talk about those details in a second. Now, when you turn 65, a few things change, right? Sometimes your insurance at work is no longer going to cover you. You start getting tons of mail and phone calls, that's for sure. And the second enrollment period, which is the annual enrollment period, happens every single year. From October 15th to December 7th is that time of the year that you're going to get a bunch of mail, a bunch of phone calls. You're going to see it all over TV. Why? Because during this period, a Medicare beneficiary actually has the chance to review benefits for the upcoming year. So a lot of times people say, hey, well, you know what? I have a plan. I feel that there should be something a little better. This is the time to do that. And if you will become one of my members, I will definitely help you to do that. I do benefit comparison meetings all throughout that period. We can set up a one-on-one appointment, whatever it may be. And if you do change your plan or enroll into a plan during this annual enrollment period, it will be effective the first of the following year, okay? Then we have something called the open enrollment period. This runs January 1st through March 31st. And what this is actually a period that if you made a change during the annual enrollment period, so October 15th to December 7th, and you're not happy with it, you get to change your plan one more time. So it's definitely a good period. Medicare just kind of put this period in about 2 years ago. So it definitely helps out with any maybe mishaps, or sometimes people make a choice and then they regret it or something like that. This gives you the time to do that. And there's also special election periods. What are these? Let's say, for example, you're already on your Medicare plan and you decide to move out of the county, out of the state. There is one special election period that if you move, you have 60 days from the time of move to be able to change your plan to something in your new coverage area. Another election period is, for example, if you're working and you decide to retire in the middle of the year, you can actually come out of your employer plan into Medicare any time of the year. And that special election period is called loss of coverage, because essentially you would be losing coverage through work. You're now eligible for Medicare. So there's a few more on the list, but those are the two basic ones that we always cover. So let's get to the nitty gritty. What is Medicare? Medicare is a federal health insurance program, okay? Traditionally is for people that are 65 and older. However, you can also have Medicare under 65. And this is all based on disability, okay? People with end-stage renal disease or ESRD can also qualify for Medicare at any age. This program is administered by the US federal government and the federal agency known as the Centers for Medicare and Medicaid Services, or CMS. This is what your Medicare card looks like. It's known as a red, white, and blue card. And, you know, I always find this very amusing, but folks tell me, hey, we're in 2021. Why is this card still cardboard? Why can't we have it in plastic? That question will never be answered. I have no idea, but I think it's very peculiar that they continue to make it, you know, a flimsy piece of cardboard being such an important card, okay? Now, one big change that has happened in the last few years for anybody that's dealt with Medicare before, your Medicare number used to be your Social Security number with a letter behind it. So if it was for you, it would be your Social Security number with a letter A. If you were getting Medicare through a partner or a spouse, it would be their Social Security number with a letter B. However, we're in the world of technology now. So Medicare back in 2017 came up with a plan and said, hey, we need to give our Medicare beneficiaries more security against fraud and identity theft. So what they did is now your Medicare number is actually a combination of letters and numbers that is unique, okay? So this is very important. The reason why I like to mention as well how flimsy and cardboard looking this card is, I've had a lot of people throw it in the trash when they initially get it because they think it's another piece of junk mail. Make sure that you do realize that this is the official Medicare card, and it usually comes attached to about a 5x7 card. You have to kind of tear it off. I had a lady tell me, well, I thought it was one of those cards that they sent me that tells me that I have $10,000, but it's just a pre-approval. So we want to make sure that I show you the picture of what the card looks like. Now, there's two parts to original Medicare. And let me just go back here. If you see Part A, it says hospital. Part B, it says medical, okay? So this card is known as original Medicare. Now, those two parts, Part A is your hospital insurance. So it covers everything inside the hospital setting, okay? So your inpatient hospitalization, hospital stay, surgeries, skilled nursing, home health, blood, and hospice are all covered by your Part A, okay? Now your Part B is your medical insurance or your outpatient services, which means your doctors, your specialists, or your lab services. So everything outside of the hospital setting, okay? It also covers durable medical equipment and any preventative services like mammograms, colonoscopies, physicals, things of that sort. Now, there's two additional parts to Medicare. Part C, which is known as the Medicare Advantage plans, and then your Part D, which is your prescription drug plan, okay? Now, Medicare has a very specific rule that says that if you have Medicare Part A and Part B, you must have prescription drug coverage, whether you take medications or not. Now, why is this important? A lot of folks nowadays, they're staying healthy. They don't like taking prescription medications, and that's great. I think that's wonderful. However, understanding that if you do not have prescription drug coverage on time, okay, there may be a late enrollment penalty when you do need it. I've seen folks, for example, that have gotten traditional Medicare Part A and Part B at 65. They weren't taking any medications. At 68, they start getting sick, and now they need a prescription drug. They go to the pharmacy says, hey, it's gonna be $400 because you don't have prescription drug coverage. And when they try to get it, Medicare says, well, you haven't had it in 3 years. Now there's a 10% lifetime penalty on top of what that Medicare prescription drug plan is going to cost. Now it's 10% of what an average Part D plan would have cost. Is minimal, but I've seen that be very incremental because of the amount of time that has passed without that coverage. So we want to make sure that you have it whether you take medications or not. So we have Part A, which is hospital, Part B, which is medical, Part C, Medicare Advantage, which we're going to talk in detail today, and then your Part D, which is your prescription drug coverage. Let's talk a little bit about Part A, which is your hospital coverage, okay? Now, Part A is premium free if you qualify. And what I mean by that is this. You do get Part A premium free if you have worked in the United States for at least 10 years, okay? If you do not meet those requirements, you can also get Part A, but it would be $471 per month that you would have to pay for Part A coverage. Now, a lot of times people say, well, Part A is zero. That's fine. I'm not gonna have to pay for anything. However, that's not the facts. The facts is that even though they do give you hospital coverage at zero, there are deductibles for some of the services received under Part A. For example, let's look at the hospitalization chart. For the first 60 days, there is a $1,468 deductible that you would have to pay. If you go to day 61 to 90, it's $371 per day if you have original Medicare. If you get past the 151st day, then you're in charge or responsible for the whole full cost of the hospitalization, which can be thousands and thousands of dollars if you've gotten to this point. Okay, so we want to make sure that we understand that Part A, even though it is premium free, if you do use it, it does have costs associated with it. Now, Part A also covers your coverage in the skilled nursing facility. Same deal applies. Zero for the first 20 days. But then once you get to day 21 to 100, it starts getting costly, okay? So just because it is premium free doesn't mean that you're not gonna have to pay anything if in fact you have to use hospital services with original Medicare. Now, let's talk about Part B. Part B is your medical coverage, everything outside of the hospital, okay? Now this does have a monthly premium, and this is $148.50 per month. Now, the way that that amount is charged to you is if you're receiving a Social Security benefit, it will be deducted from that Social Security benefit on a monthly basis. A lot of folks are deciding that they don't want to receive their Social Security benefit quite yet. And if that's the case, since there's nowhere to deduct from, what's going to happen is you will be billed that $148.50 in 3-month increments. So keep that in mind as well. And as a matter of fact, let me grab my little handy dandy calculator here. That would be about $445.50 every quarter to keep your Part B active. Okay, now if you are drawing Social Security, they will send you a letter stating that they will deduct that before they send out the Social Security benefit. Now, your Part B also has a deductible of $203, which means that that would be your responsibility before Part B kicks in. What does Medicare cover? Okay, Medicare approved amount for services received. So this means that when you have Part A and Part B, you only have 80% coverage, okay? And what happens is this: you will be responsible for 20% of any other kind of services that happen outside of the hospital setting. So imagine you go to a few doctor visits, a couple lab services, that could mount up to a bunch of different medical bills, even if it doesn't include any hospitalizations. So we want to make sure that we understand that when we have Part A and Part B, using services can be very expensive, okay? And what we're going to talk about today is what your options are going to be once you do have that Medicare Part A and Part B, to make sure that you don't fall into any kind of financial distress based on having Medicare A and B and any medical issues. So what does original Medicare not cover? Okay, if you're on Medicare Part A and Part B, you will not get prescription drugs. You cannot travel outside of the country and use it. They don't cover any kind of routine eye care or hearing tests, no routine chiropractor or acupuncture, no dental. Medicare Part A and Part B is very basic. Inside the hospital, outside the hospital, and that's it. We want to make sure that you understand that even though this is federal insurance coverage, it is a very limited coverage, okay? So you have Part A and Part B. What does this mean? Let's recap really quick. Medicare Part A and Part B cover only 80% of expenses, okay? You must have prescription drug coverage, and that's going to be an additional premium if you need to, okay? Now, you do have options to choose from to help with the cost that Medicare does not cover, and that's what we're here to talk about today, okay? What are your options? There's 3 basic options. You can get a Medicare Advantage plan or a Medicare Part C plan, which is all the craze right now on TV, okay? Medicare Supplements, which is also known as a Medigap, okay? You can also keep original Medicare and get a Part D plan, but again, that's not the recommended option because it can be very costly if you do need hospital or doctor services. So let's understand your choices. After you enroll into original Medicare, there are 2 ways to get additional coverage. Option 1, when you have original Medicare, you can get a Medicare Supplement insurance program. Medicare Supplement helps pay some of the out-of-pocket costs that come with original Medicare. Okay, and we're going to talk about the supplements and the Medicare Advantage in detail in a second. Now, understand that when you get a Medicare Supplement, that doesn't cover medication, so you also have to get a Part D plan. So you will have to not only have a Medicare Supplement, but also a Part D plan. Or you can choose option 2, which is the very popular and cost-effective option right now amongst the Medicare population. These are Medicare Advantage plans, also known as Part C plans. Now, what these plans do is it combines the Part A and Part B all in one plan. It includes prescription drug plans, and it also offers benefits that Medicare doesn't. For example, vision, dental, transportation, worldwide emergency coverage, and more depending on the plan. So we're going to go now through the different options in detail. And let me stop for a quick sec. Do you have any questions so far?
Just taking it all in right now.
All right. Okay. Now we're going to get into the bread and butter right here. Okay.
Okay.
All right. So the first thing we're going to talk about, Medicare Advantage or Part C of Medicare. Now, what is Medicare Advantage? Most Medicare Advantage plans are HMO plans. So this means that you do have to have a primary care doctor. That doctor will refer you to specialists in hospitals within the network. For example, Optum is a great network here in the South Bay. And if you have Optum doctors and Optum specialists and you like going to either Torrance Memorial, Little Company of Mary, that network will continue to be the same even once you join a Medicare option. Now, Medicare Advantage plans cover everything original Medicare covers. They include your prescription drug coverage, and they also give you additional benefits. So what do they cover? Again, everything inside the hospital, everything outside the hospital, just like original Medicare. It meets the requirement of having that prescription drug coverage. Some of the added benefits, worldwide emergency coverage. Let's say you travel anywhere in the world, most plans do have some sort of coverage, and in some cases, unlimited coverage in case of an emergency outside of the US. Give you a vision plan. The vision plans include an eye exam, and most plans give you an allowance towards glasses in case you ever need a pair of glasses. They give you a basic dental HMO. In some cases, if you want to have a PPO, there is buy-up options. And they also give you a hearing aid benefit, which includes an audiology exam every year and helps you a ton with the cost of hearing aids if you ever need it. On top of these added benefits, we also have value-added items, things like an over-the-counter allowance. They give you an allowance to be able to purchase things like vitamins, supplements, even dental floss in some cases. They offer you a nurse line, nutrition and wellness programs. They offer you a gym membership, and even transportation so you can get to and from the doctor. So these plans are very, very complete, give you so much more than original Medicare offers. Now, what are some of the advantages of Medicare Advantage? And this is the good stuff here, okay? Now, these plans have low or no premiums. So you will not have to pay anything to be a part of a Medicare Advantage plan. The only thing that you would have to pay is the $148.50, which is your Part B premium. But to join one of these plans, you will not have to pay any premiums. Now here on the presentation, I have to put that it is low or no premiums. But if you're in LA County, none of the Medicare Advantage plans have premiums. So just kind of keep that in mind. Now, something also that's really, really good about these plans, they have no deductibles. Now, if you've ever been part of any kind of insurance program, including car insurance, a deductible is an amount that the plan puts forth that you would be responsible for before they pick up any of the costs. With Medicare Advantage, that's zero. You do not have any deductibles. So that's definitely a good thing to understand. On top of no premiums and no deductibles, zero copay for doctors, specialists, and hospitals. If you remember in the beginning, we were talking about how much it would cost to have Medicare only and be in the hospital, the deductible, the per day fee. And then if you go to the doctors, only covered 80%, you would have 20% of bills. By joining a Medicare Advantage plan, you would put yourself in a situation where you wouldn't have to worry about that 20% or any deductibles. In most cases, the hospital services under a Medicare Advantage plan are covered at zero copay with unlimited days in the hospital. So that means that if you have a surgery, you pay zero. If you need to be in the hospital for a week, 2 weeks, 3 weeks, you would pay zero. So this is a great position to be in. And here in the South Bay, you have great hospitals. So you would not have to worry about anything being in the hospital or having surgery. Now, they also give you value-added benefits. Again, the vision, the dental, the worldwide emergency coverage, and more. And these plans, every year, they offer so much more. It just becomes such an awesome experience for me since I've been in this forever, seeing these plans give so many more benefits to their members that are actually very useful to them. For example, a couple of years ago, plans started adding the acupuncture and chiropractic benefit with no referral needed. You know, when you have back pain or you're stressed out and you like acupuncture, you don't want to go through the doctor and see if he thinks that you need it. These plans are now covering an acupuncture benefit that you can actually go on your own without a referral and see an acupuncturist or a chiropractic at your own discretion, which I think is awesome. Now, these plans also provide a coordination of care. And what that means is this: having a Medicare Advantage plan means that you're going to have a Medicare Advantage plan, which means that you're going to have a primary care doctor. It's an HMO. Let's say, for example, with Optum, what these plans do is they coordinate benefits really well. And this is very important for patients because a lot of times, they frown upon being part of an HMO, and they don't understand that when it comes down to a medical condition or a medical situation, you don't want to be left alone trying to coordinate services if you ever need, care after a surgery or in-home care or any kind of, chronic condition that may arise. You want to make sure that you have not only a plan, but a medical group that can kind of advocate on your behalf, that can set up those home visits, that just becomes somebody that watches after you and your health. That's what these HMOs and medical groups provide. They provide the coordination where, let's say, for example, you have a surgery and you recover at home. These plans offer you benefits that you can actually get somebody to come out to the home to help you with the activities of daily living. The medical group can actually coordinate the doctor visits to be at home while you recover. And that only happens when you have an HMO under one of these plans. I've seen a lot of folks that struggle with this. When they say, well, I chose a plan because I didn't want anybody to tell me where I can go. However, they end up going to the same doctors anyways, because here in the South Bay, it's a very tight-knit medical community. So, I know that it depends on where we live, but here in the South Bay, we're very fortunate to have not only some of the best doctors, but the top-notch hospitals, which definitely turns out good when you have one of these HMOs. So I just wanted to share that there. So coordination of care. And of course, Medicare Advantage doesn't have deductibles, and they also have something called an out-of-pocket maximum, which means that every plan has an amount set forth. For example, it can be anywhere between $799 all the way up to $3,400, depending on the plan that you choose. However, what this amount does is that this amount allows you to know that if there are any services that you have copays for, there will be a cap that you cannot surpass. So this actually brings you, again, it's kind of like a safety net. I always like to advise to go with the lower maximum out of pocket. Obviously, if something was ever to happen, I like to make sure that my patients understand that it caps out and you won't have to pay anything for anything. However, just to kind of set you and kind of clear your mind when it comes to that, zero copay for doctors, specialists, and hospitals. Only 3% of the Medicare population reach that maximum out of pocket cost, regardless of what the amount is. So we'll talk about that in a second as well. So if you choose Medicare Advantage, what is it going to cost you? Well, you will continue to pay your Part B premium, which is $148.50. The Medicare Advantage premium is $0. Okay. Copays for doctors, specialists, and hospitals is $0. And they also provide your prescription drug coverage. So the only thing you would be responsible for would be for that Part B premium, which you're going to pay for whether you like it or not, unfortunately, and any copays associated with medications. Now, one more thing about Medicare Advantage is that Medicare Advantage plans, if you're taking generic medication, most plans are now covering a 90-day supply of generic medications at $0 copay through mail order. And even if you do decide that you want to dispense it through your local pharmacy on a monthly basis, the max that you're going to pay is anywhere between $5 to $10 per medication. But we always advise a 90-day supply to keep those at $0. If you ever have expensive medications or brand medications, most plans will also offer you a discount if you do get on the 90-day supply. But again, $0, $148.50, which you're going to pay regardless. So that covers the Medicare Advantage side. Now let's talk about Medicare Supplements. I get questions about Medicare Supplements because, people get mail, people have friends, and they always have questions about different things. So Medicare Supplements. What is a Medicare Supplement? A Medicare Supplement helps cover some of the costs that original Medicare does not. Okay, you must have your Part A and Part B. So that means that you will pay that $148.50 to be eligible for a Medicare Supplement. Now, what's the difference between a Medicare Supplement and a Medicare Advantage plan? Medicare Supplements have a monthly premium in addition to your Part B premium. The premium is based on your age and your health condition. So that means that you would have to go through underwriting, okay? The biggest difference between a Medicare Advantage plan and a Medicare Supplement is that Medicare Supplements do not restrict you to a network. So they work sort of like a PPO model. They're not PPOs. However, they do not restrict you to a network. So you would not have to have any referrals to go to any doctor. Now, as long as the doctor is a Medicare approved physician, you can visit them with your Medicare Supplement. Now, you must purchase a Part D plan. Like I said before, Medicare has a very strict rule that you do need Part D or prescription drug coverage, but with Medicare Supplement, that doesn't come included. You have to buy it independently or in addition to, okay? Depending on the plan, you may receive additional benefits like vision, dental, and more. A little bit more on Medicare Supplements. They do have a rule that's called a guaranteed issue. Let's say you're turning 65. For the first 6 months After you turn 65, you have what's called the guaranteed issue, which means that you would not have to go through any underwriting and you will receive the lowest premium possible. And this is very key. And I'm going to share an experience that I just had with a gentleman. The gentleman was actually he already had a pacemaker at 65, and he needs to see a cardiologist that's out of network. He wants to go to a different cardiologist, see different doctors, get second opinions, so on and so forth. Now, because he was just turning 65, they did not take the pacemaker and the heart condition into consideration, and he got a pretty decent premium, okay? Now, he does have to pay the $148.50 plus his premium, but it gives him the peace of mind that he can go wherever he wants. If he would have waited past those 6 months, he would have had to fill out a health questionnaire, and his premium would have probably been double of what he got. So it is a guaranteed issue. It's a very good thing to know about. Now, these plans are standardized plans. So that means that there is from Plan A all the way to Plan M. And depending on the state you live in, the plans work differently. Here in the state of California, we have something called Plan G, which is probably the most popular Medicare supplement plan. It covers most of the expenses that Medicare does not cover, so a very heavy amount of that 20%. So that definitely is something that we would look at if you're interested. Now, there's no referrals needed again, so you can go anywhere as long as it's a Medicare approved physician, premium based on age and health conditions. But this is something else that's very important to know. Every year, your rates will increase between 5 to 8% on average. So if your premium is about $200 a month, every year you're going to get a little bit of an increase because as you get older, these coverages do get more expensive. Let's talk about the cost. What will it cost me to have a Medicare supplement? You will pay that Part B premium, the $148.50. The supplement premium is about $200, kindly around the $200 mark on average. Okay. The copays depending on the plan. Like I said, there are plans that will cover the whole 20%. There are plans that will cover maybe about 15%. So that depends on the plan that you go on. And then you also have to have a prescription drug plan, which is about a $40 per month average cost. And that's not including the cost of your medication. So as you can see, the supplement tends to be a kind of costly option, but again, it does provide you freedom to go wherever you want. So it might be a good fit. And to be honest, a high percentage of my clients do go on Medicare Advantage versus supplement because of that. Once you retire or you're no longer working, your financial situation tends to change. You don't want to spend too much money on going to the doctors unless it's something chronic. But Medicare Advantage does a great job at covering everything across the board at low cost. So a lot of that makes a lot of sense for most patients. Now, what if I'm turning 65 and I'm going to continue working? This is the question I get almost every day. Okay, folks are wondering, okay, if I don't want to stay, I'm not going to stop working. Can I stay the same? Well, you can. You can keep your employer coverage and decline Part B. This is what I was talking about earlier, that even if you're turning 65 and you want to continue working and you want to continue having insurance through work, I always suggest calling Social Security, enrolling into Medicare, but declining Part B. And what does this mean? This means that you would have Part A, which is premium free, okay? And it's just gonna kind of sit there for a while you have insurance at work, but you will not have Part B, that means that you won't have to pay the $148.50 because you're getting insurance through work. Now, Medicare's rule says you do not have to have Medicare as long as you have comparable coverage through work. And what's the reason why I always tell folks, do this process at 65 of getting at least Part A? I've had situations in the past which I felt so bad at the time because I couldn't do anything about it, but folks have insurance through work and they don't even bother to go check in with Medicare at 65. And then at 67, they're retiring and now they go to Medicare and they tell Medicare that they had insurance at work since they were 65. They fill out the form. They think everything's going to be legit. And Medicare says, well, unfortunately, the insurance that you had at work, we don't think that it was comparable to what Medicare gives. And they act as if they never had insurance and they assess that late enrollment penalty, which to me is very unfair, but Medicare is the one that makes the rules. So that's why I always say, even if you're going to continue working, make sure you check in with Medicare. Make sure the policy that you have at work is deemed comparable. That way you don't have to run into any issues in a later date, okay? Now, you can come off your employer plan and be on Medicare as an option anytime after you turn 65. I know that during your working history, you probably had plans that said, well, you have to wait till the end of the year. That's not the same. The same rule doesn't apply when you're over 65 and Medicare eligible. You actually have the right to go on Medicare at any time after 65. So you can do it in April, May, June, July, it doesn't matter. You can enroll into Medicare as long as you're eligible 65 plus and you have enough credits, and then we can put you on a Medicare Supplement or a Medicare Advantage plan. These are things to consider before making a decision. And I run into a lot of this as well, okay? A lot of folks have, let's say, a spouse or a dependent that's on their policy at work. It's very important to understand that if you as a primary come off that policy, everybody else comes off the policy as well. So we wanna make sure that we talk about that. And how much are you paying for coverage? A lot of folks have no idea how much their coverage at work is costing them because it's being automatically deducted from their check. So you have no idea how many people I've talked to, and I say, how much do you pay for insurance? Well, I think I pay like $50. And I'm like, I'm thinking to myself, that's impossible. And I tell them, well, go and check and let me know. And then when I didn't realize I was paying $350, and because they never go to the doctor or they just never notice because it's an auto deduction. We want to make sure that, you have options now. Once you become Medicare eligible, you have options besides just work insurance, and I can definitely help you with that, okay? Now, there's something very important called Medicare Star Ratings. I'm sure you've gotten a lot of mail, you see a lot of commercials, probably talk to friends and family about this stuff, and everybody has a different option, right? Everything says 0. They offer you the moon and the stars. Well, the stars are actually important in this case because Medicare gives all of these plans a star rating based on a 5-star system, okay? And this is where I come in, and since I can represent different plans, I ask you 3 basic questions. I say, who's your doctor? Are you seeing any specialists? What kind of medications are you taking, if any? This is gonna help me determine which plans we can take a look at. And there's 13 different Medicare Advantage plans in LA County. What helps me narrow it down? The star ratings. The star ratings is a very important thing when it comes down to the Medicare plans, because there are 3 specific criteria that Medicare uses to give these plans their rating, okay? Number 1, how members rate a plan's services and care. It's very important for the patients to be satisfied or the members to be satisfied with their plan. How well doctors detect illness and keep members healthy. This has a lot to do with the medical group. A medical group that sends you notices to go in for your physical, colonoscopy, mammogram, bone density. These are medical groups that actually care about detecting illness before it happens or before it gets chronic. A lot of these plans that have great relationships with these medical groups are doing a great job at doing this for their patients. And of course, how well a plan helps members use recommended and safe prescription medications. I'm sure you hear a lot on the news and amongst the community, how some doctors just prescribe medications all over the place. Medicare wants to make sure that the doctors that do accept these plans not only are keeping their members healthy, but are doing the right thing for their health conditions. So the Medicare Star Rating system is a 5-star system, and it definitely helps us kind of sift out which plans are better than the others, and we can definitely narrow down the different types of plans that we can help you enroll into. Here goes this handy dandy chart again. I know it's a lot. I know it's all brand new information, but let's review. Today we learned that with Medicare Advantage, not only will you get hospital stays at 0, it will help you with doctors and specialists at 0. Preventative services like flu shots would be covered. It would also cover your prescription drug coverage. It gives you vision coverage. It gives you hearing coverage, routine dental. It limits your annual out-of-pocket costs and also gives you gym over-the-counter benefit and worldwide emergency coverage plus more. So the Medicare Advantage plan is a very complete option. The Medicare Supplement, it helps you pay for hospital stays, doctor specialists, and preventative services. If you go on a Medicare Supplement, you have to get your prescription drug plan independently. It will not cover vision or hearing. That most likely is going to be a buy-up option for additional benefits. Dental is also not covered, okay? It does limit your annual out-of-pocket costs depending on the plan that you choose. And The gym, the over-the-counter, and the worldwide emergency coverage is also buy-up option for most plans. So it's not something that's included. A Medicare supplement will help you cover the gaps that Medicare doesn't when it comes to in and out of the hospital care. And original Medicare, this is also something you can do, but it's not the most recommended option because of all the costs associated with the services. So will it help you pay for hospitals? Yes, but not in full. Will it help you pay for doctors and specialists? Yes, but not in full. It will also help you with preventative services and like flu shots, but again, not in full. You will have to get prescription drug coverage on your own, and all the other things are not covered at all by original Medicare. You cannot even buy into these options because original Medicare is only hospital services and outpatient services. So with knowing these three different options that you have once you become Medicare eligible is very important. And like I said, the most recommended option is definitely the Medicare Advantage side when it comes down to not only cost control, but quality of service. Let me help you make the right decision at the right time. We can set up a one-on-one appointment. You can visit my website. I have a lot of useful information on there, which is insurancebystella.com. I also speak Spanish. If you have any Spanish-speaking friends, this is my cell phone number. You can call me or text me with any questions and anything that you may need.